Hey guys, it's Alicia. Again from the Midwest. It is overdue for an update for you guys. So I think at this point it's been about 8 weeks, so like 2 months into the program. What has been going on? Jeez. Okay, study. Um, Yesterday had another practical lab. This one was over med gases. I'm actually going to show you some of the goodies we got for that class before taking the exam. So I guess we can just start there. So this is my little bag that I have my stuff in. So let's open it up. Let's see. Um, we got some new masks and things. So for this is going to be, it's considered a three-way mask. The way that I have it set up here, it's considered a non-rebreather because it's got the bag, it's got the little things cover here, and there's one inside there as well. If you remove these little covers, right at that point it's going to become a partial non-rebreather. And this also turns into a simple mask. So hold on, I dropped a piece. So if you take the bag off and remove everything, it becomes a simple mask. So for these, we had to know the flows, we had to know the FiO2s for each of these. The next one is going to be this mask here, which can hook up to, I haven't used this one yet, aerosol therapy. So with the aerosol therapy, you've got 4 different things that can connect to it. You've got this here, which is our aerosol mask. You also have something that's going to be considered your trach collar. You've got a face tent, which is like this plastic tent thing essentially that is usually used for patients that have trauma. And then there's something that's going to be considered the T-piece. You'll learn about that if you haven't already. And another mask we have, which we'll use with this, is going to be called the Venti mask. The Venti mask has these different connections that connect to it that will, it varies by manufacturer. So each one of these has not only a FiO2 on it, but also the flow that you'll use with this one. This one in particular is 31%. With a 8 liters per minute flow for the patient. The lab practice was kind of neat. We had three different things we had to do. We had hold on, and we can't forget the nasal cannula. That's something that you guys and everybody commonly sees in your patients, whether you've been in the hospital visiting a loved one or on the medical shows that everyone loves. So it's, that little nasal cannula there. So yeah, the 3 things we had to do. We had a patient that had a history of COPD that came into the hospital with some difficulty breathing. He's usually on 2 liters at home. He came in. They had him on 3 liters on a simple mask, and with that one in particular, if you are less than 5 liters, it's going to cause the patient to intake a whole lot of carbon. So with that patient, you just kind of had to change his oxygen therapies and then put him back to his normal 2 liters that he is at home, because I'm not sure at this point we've talked about patients with COPD that run on a hypoxic drive, so they just need less. Their oxygen is usually going to be between 88 and 92%. If they're higher than that, that means that you're knocking them out of their drive. What else? We had a patient with a trach that we needed to do closed suctioning on. So with that, we had to use a T-piece and then closed suctioning. And we also had to set up some aerosol tubing on that patient and actually, set up the suctioning. I did pretty decent on that practical. I ended up getting 95%. The instructor that I had it with said that I did well. I just didn't talk to the patient enough. So even though it's a mannequin, I need to treat it like a real person and let them know everything that's going on, even if the person is awake or not. I get it. Cool. Another exam that we had was in our cardiopulmonary pathophys class. That exam was rough. For that one in particular, it dealt with patient bedside assessments. So with that, we were dealing with learning the breath sounds, tracheal shifts, percussions, infirmitus, and as far as how you go in and assess the patient, how to properly ask questions, no leading questions. You don't really want to do too open-ended because you kind of want like an exact answer from the patient, which can sometimes be a little bit difficult. And we did diseases. Those diseases. So yeah, anyways, so the diseases that it dealt with was COPD, which is kind of like an umbrella for chronic bronchitis and emphysema. Whew. And so we dealt with that. We dealt with croup and epiglottitis, pleural effusion, pulmonary edema. What else was there? Asthma. Ooh, I want to forget this so bad. Asthma and some other ones. So based off of that, we were given different case studies where based on the patient's percussion, fremitus, if there's a tracheal shift, if they had a fever, different symptoms for the patient to have based off what we were told. Even age was included in that, and so we had to determine what disease the patient had. Like I said, that exam was rough to me. I did end up getting 92% on that exam. The first exam I got 80%, and so my goal for this test around was for me to get higher than a B-. So the professor did remove 4 questions, so if she had left those, I technically would have gotten 86%, which I still would have hit my goal of getting higher than that B- that I got on her first exam. The other exam we had was in our pharmacology class. That exam dealt with the autonomic nervous system, so it dealt with the sympathetic and parasympathetic branches, the different medications that you use based on that branch. So we had learned about our short-acting and long-acting messenteric antagonist medications, and also our short-acting and long-acting beta-2 agonist medications, dealing with like the bronchodilators. I mean, I kind of understood that a bit more. It just kind of based off of some of the quizzes and the material that's being presented by the professor. I like that class. I actually like most of my classes. I struggle, and my mind doesn't really work like others when it comes to the pathophys class. So I just have to study a lot for that class. I'm studying in a group, at least twice a week, and then I study on my own as well. But yeah, so for the pharm class, that exam I got 92% on that one. I'm happy with it. I'll take it. What else is going on? I'm actually sitting in the atrium at my school right now because I have to get my live scan done so that I can do clinicals next semester. I think we find out where we're going at the end of November. So we're doing live scan, and then I'm actually with a couple other people from my class are volunteering at, it's called Career Quest, where I think it's a bunch of 8th graders are going to be coming through, and we get to tell them about the respiratory therapy. So that'd be kind of fun. I don't know what I'm supposed to say to them, but there might be a little spiel or something that we're supposed to say, but I don't know. But yeah, so since the last time I talked to you guys, things have been going good. I'm really liking the program. It was fun to kind of get some materials to work with. Been building some relationships with people in class, which makes things nice as well, because we're all going through this together. Just knowing to study. Right now I'm kind of at a loss of what's coming on to the next exam, just because last week was kind of a break. Like, one of our professors, unfortunately something was going on, so another professor stepped in to teach our class, and a lot of equations. Oh yeah, on the lab practical, we did ABG stuff, y'all. So we're starting to do some ABG things. It was more so just dealing with the numbers from what we received. So with that, we had to let them know based off of the pH, the CO2, and the bicarb, what kind of compensation was going on with the patient. So at first that was kind of hard, but one of our professors gave us like some practice questions. So like a total of 30 practice questions. There was 2 of them, both were 15 questions. We worked on it some in lab and in class, and I watched the YouTube video that one of my classmates posted on our Facebook page, which was really helpful. Let's see. Oh, and also we dealt with the oxygen tanks. We mostly dealt with the E and H tanks. So we learned about that too in the last few weeks. So yes, it was med gas therapy that we learned about in our assessments class. Let's see. Yeah, things are going good. I'm still enjoying myself. It's still really tough. It's just learning that balance. I have had to say no to some things, maybe rearrange them a little bit with friends and family, but it will be worth it. It's just like a short-term thing. So you'll probably hear from me again close to, I guess, towards the end of the semester. Right now, I'm going to be preparing for my essential drugs test in my pharm class, and I've got 2 more exams coming up the next couple of wees in my patho-phys class. Yes, I know, we just did an exam, another one's coming up. And then in our basic respiratory 100 class, and that will be dealing with like a lot of equations and Henry's laws, Dalton's law, Charles's law, some equations for PaO2, like that. So maybe I'll come back after those exams the next couple weeks and go over the information that we learned from that. In the meantime, if you have any questions, feel free to put them below. I'll be more than happy to answer them for you. Yeah, I guess subscribe and follow if you want to. So I plan to have you guys with me through the rest of this journey, and what's today? Wednesday. Enjoy the rest of your week. I hope you have a wonderful weekend. Tomorrow's Halloween. If you have kiddos, it's raining here in Michigan, so we might be doing something inside. It might even snow, but have fun. Eat some candy. Have some chili or something. I am. And some pie. But yeah, just enjoy yourselves. Until next time, thanks for watching.